Hi guys, this is middle ear barotrauma. You can see the tympanic membrane congestion or arrhythmia because of pressure changes, and this is the eardrum perforation. If you ascend from the surface about 80 km, the oxygen saturation is about 0, and at surface the oxygen pressure is about 1 atmospheric pressure. If you are going depth about 60 meter, the atmospheric pressure is going to increase about 5 atmospheric pressure. If you are diving, there is compression syndrome. If you are ascend from the surface, then it is decompression syndrome. For middle ear, there is middle ear trauma because of acoustic dysfunction which are not going to compensate the external ear pressure or middle ear pressure. If pressure during descent is increased on external ear side, there will be eardrum retraction, and ultimately if rate of descent is higher, then eardrum perforation is common. At about 80 km from the surface, there is oxygen saturation is almost nil. In that case, the external ear pressure is less and middle ear pressure is higher. Then in this situation, tympanic membrane is going to be bulge, and there will be mucosal edema. In both situations, during ascent or descent, there will be mucosal edema, but during descent there is retraction, and during ascent there is bulging of tympanic membrane because of pressure changes in the middle ear. And during descent there is negative middle ear pressure. During ascent from the surface there is positive middle ear pressure than the external ear. And this is the Boyle's law, in which at constant temperature, pressure is inversely proportional to the volume. If pressure is higher, the volume of air will be less. If pressure is less, then volume will be higher. Same law is Henry law. In Henry law, if you increase the pressure, the dissolution of particular gas is higher. If you are decreasing the pressure of the air, then dissolution of particular gas is less. So this is Henry law. Both law are applicable in the middle ear barotrauma, so that you can better understand the middle ear pathology. Most of the patient coming from us from air attendant, mainly these type of patient come to us, main complaint is ear fullness, giddiness, or ear pain. If you see during descent, classical presentation will be, if eustachian tube is functioning well, so there is equalization of middle ear pressure. If there is no middle equalization, then middle ear pressure is not going to compensate, and there is ultimately retraction of tympanic membrane. If rate of descent is higher, there is perforation because of external side pressure is higher. In both situations, the mucosal edema is there. This is modified Teats classification, in which there is symptom no sign. This is grade 0 of Teats modified classification. Grade 1 is redness and retraction. Grade 2 is intratympanic membrane hemorrhage. Grade 2 and grade 3 is gross tympanic membrane hemorrhage, and grade 4 is hemotympanum, and grade 5 is perforation of tympanic membrane. In both situations, hemotympanum and perforation, we have to wait for 3 months for conservative treatment. Mainly decongestant is given. If hemotympanum persists, we have to do laryngotomy. If perforation persists, we have to do tympanoplasty. According to the grade, we can manage the middle ear barotrauma, and most of the treatment is symptomatic. And this is O'Neill's grading. In this, grade 0 is normal, grade 2 is mild congestion, grade 1 is mild congestion, grade 2 is perforation and gross intratympanic hemorrhage. So this is three grading only. Grade in O'Neill's classification, grade 0, grade 1 and 2. So these are three graded in the O'Neill's classification. And if you see grading of treatment, if there is clinical sign and symptom persist, if there is no clinical sign or no symptom, then you have to give only painkiller. If there is sign and symptom persist, you have to give decongestant painkiller. And if there is perforation or hemotympanum, then you have to treat with medical management as well as surgical management like maryngotomy and tympanoplasty mainly. If you see endoscopically there is eustachian kingdom dysfunction is persist, then you can do eustachian tube ventilation surgeries, and you can do balloonoplasty of eustachian tube so that its patency will be maintained. So these are the common surgeries we can do in the barotrauma. So most of the barotrauma patients are coming because of pressure changes, and we have to give only medication that is required is painkiller most of the cases. And these type of cases, if these allergy or any eustachian tube dysfunction is because of persistent nasal pathology, then we have to correct the nasal pathology like deviated nasal septum or eustachian dysfunction if patient want to fly in regularly. So that if you are giving some medication like oral decongestant like solvent cold or Vicodin or any medication decongestant is very helpful. If you are giving 1 hour before the flying, that will decrease the symptom. All other medication like plugging, swallowing, Valsalva is not going to be help in this flying. So these are the commonly asked question in the barotrauma patients. So this is all about management of middle ear barotrauma. Thank you so much.